going to be talking about integrative oncology. And I guess a little bit of background for me before we get started. So I'm an oncologist by training, and was a practicing oncologist for a number of years. And in the past few years, I've become increasingly interested in integrative medicine because I felt like patients were often struggling with symptoms and we didn't always have a great way to treat some of them. There were some that were really complex and sticky. And as I started thinking about ways to manage some of those things like neuropathy and nausea and fatigue, concepts in integrative medicine started popping up. And so I did some additional training, and now within the past few months, actually, my practice has changed entirely to integrative medicine and specifically integrative oncology. So I'm really excited about that, and I'm happy to share with you today some of the tools that exist in integrative medicine and what integrative medicine is. So let's just start with that. Let's start with an introduction to what integrative medicine is. So when I talk about integrative medicine, it has a number of different definitions, but I think about it as an approach to medicine that combines evidence-based medicine, kind of leading edge and emerging technologies and innovative therapies, as well as other complementary approaches that can address and improve overall health and wellness. The goal of integrative medicine is really to address not just the physical components of health, but also emotional, mental, social, and spiritual aspects of health in a holistic manner. And integrative medicine is not separate or different from conventional medicine necessarily. It's meant to happen in conjunction with conventional medicine and in conjunction with kind of typical cancer therapies. And the idea is that it can enhance the effectiveness potentially of medical care by incorporating a broader range of therapeutic options. And it can just generally improve health and well-being. And the idea, one of the core principles in integrative medicine, is that everyone is unique, everyone is different, and different people may need different things. So we see that having this combination of tools to draw from can be really beneficial for different people. And so in cancer specifically, integrative medicine comes up a lot because there are a lot of challenges that come up in cancer treatment. There are symptoms like brain fog, numbness in your hands and feet, appetite changes, weight changes, fatigue, decreased endurance, decreased immunity, all those things. But in addition to those physical symptoms, there are these other symptoms too, these other challenges that arise in other contexts like social, emotional, spiritual, even existential challenges. And so the goal then is to treat each person as a whole person, not just as a cancer diagnosis, not just someone with breast cancer, for example. We also understand that everyone's unique from a biological standpoint, as well as a psychological, lifestyle, and environmental standpoint. And so, we try to look very broadly at all of these pieces when we think about how to best take care of an individual. And so this is all done in conjunction with a primary oncology team. And so we kind of help, create the foundation in many ways, I think, for effective treatment. And integrative medicine, I think, has several core features that are important. And so and the talk is going to be broken down into each of these different categories. It's a field of medicine that is patient-centered, it's holistic, it's evidence-based, it is focused on prevention and wellness, and it is collaborative. So let's talk about each of those things. I'm going to give you some examples of specific therapies. We can even try out a couple of practices ourselves during this conversation. And then at the end, I'll try to leave 15 or 20 minutes for questions and comments. Okay, just looking at the chat. Okay. So what do we mean when we say integrative medicine is patient-centered? So what I mean by that is that we think of the individual as being at the center of the healthcare journey. And this is a figure that I really like in terms of thinking about patient-centeredness. This is one from one of the integrative medicine textbooks that we use. Um, so it understands that everyone is unique, and that everyone has, important physical, emotional, mental, and spiritual needs and preferences. So the idea of patient-centered care really focuses on the idea of listening, really being engaged in what the patient is saying, what you are feeling, what you are needing, um, and respecting an individual's values and beliefs. So this concept, this figure is really a framework for actually proactively engaging in your own health and well-being, and recognizing that health in the context of cancer therapy is much more than surgery or chemotherapy. So you see that you, the patient, is in the center. Moving out from the center, we see that there are a lot of components of self-care that start to play into your journey. These include things like your thoughts and patterns, who and what you surround yourself with, and how you nourish your body and your mind. And then outside of that are other people who are involved in your care. And so that includes professionals who can help you. So those might be the members of your core care team. And then beyond that, it also includes other people around you, your community. So it acknowledges that self-care is important and really fundamental. And it also acknowledges that no one is doing this alone. So, I like this general framework because it says that care includes you, self-care, professional care, and then support from other places as well. And that is what leads to kind of whole person health. And so one of the tools that I think about using is just kind of a set of questions that can be helpful when thinking about how to make changes in your life, and how to focus on what's really important to you. And these are three questions that we sometimes incorporate in parts of the encounter. And the questions are, what? And so that is, what gives your life meaning? What's important to you? What gets you up in the morning? And why are health and living well important to you for those things? Another is where. So where do you need to start to improve your quality of life? Is it diet, exercise, sleep? Is it something else? Is there really one symptom that we need to focus on, or is it kind of more of an amorphous thing that we need to do? So, as practitioners of integrative medicine, we try to take less of a paternalistic approach of figuring it all out for the patient. We try to work together to figure out what is the approach that makes the most sense for you as an individual. And then finally, there's who. So who do you need to support you on your journey? No one is an island. We're all connected. We all need those connections, and we can benefit from those connections. And so we can help kind of think through that with you. So the next category is holistic. So integrative medicine is holistic. And what that means is that health and well-being are influenced by many factors. It's not just your cancer, it's your lifestyle, it's your environment, it's genetics, it's social interactions. And so the goal is to treat the whole person rather than just an isolated symptom or disease. And we try to take into account the interconnectedness of different parts of health. We sometimes talk about this as a multi-omic approach. And so omics in general that's kind of a term that has become very, very common in the world of cancer therapy, but it is spreading to other types of medicine as well. And in cancer, we often talk about the genome, which is kind of your specific genetics. But there are other kind of categories of the body that I think are important as well. And so we'll talk about two of those specifically, the microbiome and the metabolome. But there's also the exposome, which is kind of what you encounter outside of the world. And so, those are sometimes things like weather, seasonal changes. There may be kind of toxins and things that you encounter that make it harder for your body to function optimally. And then there's the sociome. And so that's the people you encounter and the kind of social environment in which you live. And so this figure here is a particular framework that we sometimes find useful in the world of functional medicine, which is kind of a field within integrative medicine that looks at your health from kind of several different angles, with a recognition that a particular symptom, say fatigue, might have a lot of different root causes. It's not just, fatigue just doesn't happen out of the blue. It is created from somewhere. And so sometimes that's cancer treatment. Maybe it's kind of anxiety related to cancer treatment. Maybe it's other things. Maybe it's a kind of a specific nutritional deficiency that's developed as part of treatment. And so the precise manifestation of fatigue might be really different for two different people. And it depends on kind of what the overall picture is for that person. It depends on the individual's genes. It depends on their environment. It depends on their lifestyle. It depends on their specific treatment. And so treating fatigue just kind of generally as fatigue may not be as effective as treating fatigue when you're trying to kind of take many of these different variables into account. And so, one example of a tool that we sometimes use to think about this multi-omic approach is we sometimes take like a deep dive into an individual's microbiome. And so we can do some testing to look at how healthy the microbiome is. So we're increasingly finding that the microbiome has a lot of implications for cancer treatment and recovery. If there's damage to the microbiome, then that can lead to challenges with gut health more generally. And then that can be something that can really contribute to fatigue and brain fog. And so we can do some testing to look at if there's a lot of inflammation in your gut, if the balance of the microbes in the gut is beneficial, if there's kind of some underlying infections that we might not be picking up, and if your digestion is functioning well, if you're actually breaking down the food that you're taking in. And each of these areas can end up being kind of hidden sources of problems that we can uncover with some more sensitive tools. Another category is, if we're thinking about this multi-omic approach, is looking at the metabolome. And so the metabolome is basically it's a way of looking at all the energetic and chemical processes that are happening in the body and trying to get a sense of if things are running smoothly or if some things need a little more, like a little more oil in the cylinder or gas in the tank or something like that. And so we can look at kind of specific components of metabolic function, and there may be things that we find that are different for different people. And so, we look specifically at the efficiency with which the body removes sources of stress. And so that's something that we think about as using antioxidants to remove oxidative stress. Oxidative stress is a thing that causes a lot of damage to genes, to lipids, to proteins, to other things in the body. And so the goal is generally to minimize that. Oxidative stress ends up being a big challenge in cancer treatment because many of the treatments that we use are designed to create oxidative stress. And there's a lot of benefit to that, but there can be problems that come with it too. We look at kind of mitochondrial function. So mitochondria are the energy cells basically in the body. Each cell in the body has mitochondria. And these can be functioning efficiently or not efficiently. And so we look at kind of specific markers of mitochondrial function. We look at general markers of inflammation by looking at the balances of different inflammatory markers. And so the goal is not to have no inflammation. Inflammation is an important part of life, and that's how you kind of respond to infections and things like that. But it's important that it's balanced. And so we look at that balance. We look at toxin exposure. And so we sometimes look at specific toxins that can make it harder for your body to process chemotherapy, for example. And then we look at something called methylation. And so methylation is another metabolic process in the body that's really fundamental. It's a way that that a lot of systems in the body move forward by transferring these things called methyl groups. And so now let's talk about evidence-based. What does it mean to be evidence-based, and why is integrative medicine evidence-based? So the idea here is that integrative medicine incorporates evidence-based practices from conventional medicine, but also includes evidence from other kind of healing traditions. And so the principle acknowledges that there's a lot of value in other healing approaches too, things like acupuncture, massage, yoga, nutritional counseling, and mind-body practices. And so I wanted to talk about just three kind of specific evidence-based practices here, ones that often come up, and that are not necessarily talked about quite as often. And one that I like to start with is acupuncture. So acupuncture is really interesting. It's this ancient form of medical therapy that's been around for thousands of years. It was first talked about in medical texts that were written over 3,000 years ago. And it's probably actually older than that too. And acupuncture can kind of be tricky from a Western standpoint because it doesn't necessarily make sense to how we think about health. But there are some really interesting studies that have been done to try to figure out how it works from a biomedical framework. From the perspective of Chinese medicine, it works by manipulating the movement of energy or qi through channels, or kind of meridians is what they're often also referred to as, that exist throughout the body. And insertion of these very fine needles onto carefully selected points on the skin can rebalance bodily disharmony. One kind of teacher in this field talks about it as reducing what is excessive, increasing what is deficient, circulating what is not moving, and stabilizing what is out of control, more or less. So again, we don't really know 100% how it works from a biomedical standpoint, but there have been some really compelling neurophysiological theories about how it works, which I'm happy to discuss with anyone if people have interest in that. But acupuncture has really grown a lot in the West since the 1970s. There have been over 10,000 randomized controlled trials, and it's increasingly accepted as an effective treatment modality throughout the world. Specifically in the world of cancer, it's really becoming more prominent as well. Here's a list of some of the common symptoms that can be addressed with acupuncture. And I think some of the ones on here that are really worth noting are neuropathy, hot flashes, fatigue, dry mouth, lymphedema. These are ones that can be pretty difficult to treat with conventional therapy alone. Not always, but sometimes we just don't get quite as far as we'd like to. And acupuncture can be really helpful in those instances. And actually, acupuncture is something that is now recommended by a lot of the large professional organizations in oncology. So the National Comprehensive Cancer Network includes acupuncture as something to consider for a lot of components of survivorship care. So kind of wherever you are in the cancer journey, whether you're just diagnosed, whether you're in the middle of treatment, whether you're post-treatment but still have symptoms, it's something that can be considered. And then more recently, ASCO, which is the American Society of Clinical Oncology, and SIO, which is the Society for Integrative Oncology, released some joint guidelines regarding integrative medicine for pain management in oncology. And actually for joint pain for women with breast cancer on an aromatase inhibitor, acupuncture was at the top of their list of things to consider. And many cancer centers offer acupuncture. We unfortunately do not have any acupuncturists on staff. either in the main cancer center or in the Center for Integrative Medicine. But we do have a lot of local practitioners that we work very closely with. And we're happy to kind of provide lists of people we know and trust. All right, so that's acupuncture. Let's talk about mindfulness. So mindfulness has been defined as paying attention on purpose in the present moment and non-judgmentally. And so the idea here is to just do one thing and focus on that thing, with the ultimate goal of gaining more control of your mind so that you can respond to life rather than react to life. And there have been a lot of formal mindfulness programs that have developed over the past 50 years, really. The best study of these is something called mindfulness-based stress reduction, or MBSR. And this is an 8-week program offered at many organizations across the world, including here at Jefferson. And what it can do is it can help you calm your mind and body, help you kind of reconnect your mind and your body, and can really help cope with illness, pain, and stress. It's been examined in many studies, thousands, I think, probably at this point of studies, including a number of studies specifically for patients with cancer. And it has been found to help with stress, coping, quality of life, sleep, depression. And so, I think this makes a lot of sense in the world of cancer treatment, because cancer can be one of the most stressful experiences in your life. Not only is the treatment itself a major challenge, but then there are all these other complications that come up about work or family or finances, which make the cancer treatment itself even harder. And while it's not proven that stress itself can cause cancer, chronic stress certainly can make it harder to treat. And so, reconnecting with the body and having strategies to contend with physiologic and other types of stress can be really helpful. So one simple tool, so MBSR is, it's a formal structured program. It's an 8-week course, but there are a lot of ways to engage with mindfulness and other stress reduction approaches that don't require like an 8-week commitment. And so one simple tool is something called the 4-7-8 breathing technique. And it just takes a few seconds. We can actually do it right here, right now. And the way you do it is, first, you're gonna just sit comfortably, and I'll demonstrate, and then we can do it together. You let your lips part. You make a whooshing sound, exhaling completely through your mouth. And then you close your lips, and you inhale silently through your nose as you count to 4 in your head. So count to 4. And then for 7 seconds, you hold your breath. And then you make another whooshing sound, exhaling from your mouth for 8 seconds. And you can repeat this a couple times. And so let's do this. We can do this together. And so it's breathe in for 4, hold for 7, breathe out for 8. So we'll start now. Breathe in for 4, 1, 3, 4. Hold for 7. And breathe out for 8. And that's it. And that's like a really core fundamental practice that can be used in a lot of different situations. You can do it on the bus. You can do it in the infusion chair. You can do it a couple times in a row. And so, that's a nice tool. There are a lot of other tools. Different approaches may work better for different people. And if you're interested in looking at some other approaches, on the Marcus Institute website, there are a number of guided meditations that are available, kind of freely available for downloading or just listening to online. And so if you Google or otherwise search for the Marcus Institute website or search for MBSR guided practices, you'll find a number of different ones that go into a little bit more detail than what we just talked about. Okay, I want to talk briefly about IV vitamin C, because this is something that comes up a lot in the world of integrative medicine. And there are a lot of kind of mixed conceptions in kind of in both ways about whether it's useful or not, if it's a miracle drug or not. What I would say is that vitamin C, IV vitamin C, can actually have some pretty compelling benefits. There are a couple of caveats to that. So let's talk about vitamin C first. So, this is something that has been known for probably since the 1920s, I think is when it was originally discovered. It's become much more popular since the 1970s or so, when a scientist named Linus Pauling really was pretty convinced that it was a cure-all. And he was a smart guy. He was a Nobel Prize winner. And he was really interested in understanding vitamin C, not only for things like the common cold, which is how we often use it these days, but also for things like cancer. And so what is vitamin C? It's an antioxidant. And so, antioxidant, that's a compound that protects cells in the body from damage by free radicals. And free radicals cause this thing called oxidative stress, which can damage DNA and proteins, lipids. And oxidative stress is kind of a root cause in many diseases, including cardiovascular disease, neurologic disease, cancer probably as well, and a lot of other age-related concerns. So antioxidant, those can be helpful. It's a little bit more complicated than that. But basically what they do is they scavenge these free radicals, and vitamin C is an example of one of these antioxidants. Vitamin C is also really helpful for collagen formation. And so it's actually kind of a crucial factor for making collagen, which is a fundamental component of skin, tendons, ligaments, blood vessels. It's responsible for strength and elasticity in these tissues. And so scurvy is a vitamin C deficiency, and it results from lack of effective collagen formation. You don't need that much vitamin C to avoid scurvy, just like a small amount, but people get it. So it is something to consider. And then it can also enhance immune system. It does this in a couple of ways. One, the collagen formation helps with skin integrity and kind of mucous membrane integrity. And so those are kind of the first line of defense against pathogens, but it can also augment the effect of a variety of immune cells. And it has some kind of regulatory mediating effect on the immune system, generally speaking. And then finally, it also has a role in iron metabolism. So it increases iron absorption, and then it helps the body hold on to iron a little bit more. So the role in cancer therapy is interesting, because if you treat someone with really high doses of IV vitamin C, and this has been studied in like outside of the body, but also in cells in the body and in people as well, high doses of vitamin C actually have a different effect. They have these effects, but in addition to having an antioxidant effect, they actually have a pro-oxidant effect, which is counterintuitive. And it's really a pretty specific effect to cancer cells. And so how does this happen? There are a couple of reasons it happens. But one of the biggest reasons is that cancer cells are actually much more sensitive to oxidative damage than normal cells. And there are a number of reasons for that. We don't need to get into them right now necessarily. But when there is an oxidative stress, cancer cells, once they become cancerous, can be injured more quickly. And this is kind of a fundamental premise for a lot of the chemotherapy that we use. But vitamin C is really unique because it is in many ways pretty specific to cancer cells, based on kind of some of the biology of how the cancer cell works, and how vitamin C works in general. And so two of the ways that it kind of is beneficial is that cancer cells tend to use a lot more iron than normal cells. And vitamin C works with iron to create more oxidative damage once it's taken up into a cell. And then one of the metabolites of vitamin C can also be taken up more by cancer cells than normal cells, by kind of this particular pathway that gets upregulated. And so it's not standard of care. There are a lot of clinical trials. There's a clinical trial that's about to open here at Jefferson in prostate cancer. But a lot of people end up getting it kind of on their own. And so that is something that we do at the Marcus Institute, kind of as a specific cancer treatment augmenting therapy. And so it seems to be beneficial as kind of an adjunct to cancer treatment. And it also is beneficial in reducing a lot of symptoms associated with chemotherapy. And that's been pretty well documented at this point. It's another thing we can talk more about if that's a question that people have. And so moving on, let's talk about prevention and wellness. And so integrative medicine really heavily emphasizes preventative measures in promoting overall wellness. And so this includes talking about lifestyle choices, about nutrition, stress management, which we've talked about a little bit already, physical activity and exercise. Those are all factors that end up being quite important in someone's long-term well-being. So I thought we would just talk about three of these somewhat briefly. We'll talk about diet, activity, and sleep. And so diet, I find that diet can get really confusing, but I don't think it needs to be. And so, we know that a healthy body needs a healthy diet to function at its best. And this is really important for everyone. It's especially important if you have cancer. A good diet can help maintain the immune system. It can prevent tissue breakdown. It can enhance the ability to manage side effects. People work and treatments work best if people are well nourished. So there are a lot of different diets out there. Sometimes it's helpful to have a kind of a very specific dietary approach. Sometimes it's not helpful. So I think it's helpful to start kind of at a high level to talk about general principles with respect to diet. And then in specific instances, we can dive into kind of much more specific instances. But I like kind of these three principles. The first is eat enough. And it can be easy if you're getting cancer treatment, for example, to not eat that much. You might have a low appetite, you might have diarrhea, you might have these other symptoms. And so one thing can be just eating smaller, more frequent meals. It may just be not realistic to have 3 large meals a day. There may need to be more snacking. There may need to be 6 meals a day, something like that. I think the next point is that you should eat food. And so there's a quote from a book by Michael Pollan. The book is In Defense of Food, in which he says, eat food, not too much, mostly plants. And I think that's the best dietary guidance that I have encountered thus far. I've yet to find one that's better. But what this means is eat real food. It means things that are natural, things that are not highly processed to the extent that you're able to do that. Eat enough, but don't overdo it. It's important to maintain weight during cancer treatment. And in some cases, actually, it may be beneficial to gain weight. Having excess body fat isn't generally helpful, though. So the idea is to try to stay at a healthy weight. And then the mostly plants part is that fruits, vegetables, and whole grains should really be the foundation of the diet. And so, leaning more heavily to plant-based proteins may be beneficial. I think it's not always the right move for everyone, but sometimes you could try eating beans and peas instead of meat a few times a week. But certainly eating more fruits and vegetables every day can be beneficial. And then colorful fruits and vegetables are particularly great, as they have a lot of kind of natural health promoting substances, antioxidants, things like that. Maybe slightly more specific guidance. It's good to get up to 4 cups of vegetable per day. Some of the best proteins are probably plant-based proteins, and fatty fishes like salmon is particularly good. It's very rich in omega-3 fatty acids. I think more broadly speaking, one of the best studied diets in patients with cancer and those without cancer is something called the Mediterranean diet, which is, a pretty well-known diet at this point. but it's just something, it's an example of something called an anti-inflammatory diet, which is a diet that generally promotes health and wellness and lowers inflammation. And an anti-inflammatory diet, you can follow it by like the eat food, not too much, mostly plants principle. And then the final thing is to stay hydrated. That can be a hard thing during cancer treatment. Generally, we recommend 8 to 10 ounces of water per day. Some people need more if they're having diarrhea, but hydration can sometimes help with appetite. If you're really dehydrated, then sometimes your appetite goes down too. And it can help with other symptoms too, like fatigue sometimes. So I think everyone needs a little bit of a different approach with diet. It can be a source of stress, and I think it doesn't have to be. And that's something that we kind of try to sort out with people. And it can be helpful to work with a nutritionist too. And I know that the Cancer Center has a number of very, very highly qualified nutritionists on staff. One resource that I really like for patients with cancer is something called Cook for Your Life. This is a website from the Fred Hutchinson Cancer Center that includes recipes for a variety of dietary preferences, as well as for symptoms that can arise during treatment. So they have one diets kind of for, or guidance for people with nausea or diarrhea or constipation or taste changes. It has some instructional cooking videos and has some helpful information. So this is something that I've recommended for a lot of patients. And then we sometimes have more specific recommendations for individuals based on their circumstances. One other brief comment about diet is there's this emerging tool in the world of integrative medicine called nutrigenomics. And it's something that we're starting to use more, but nutrigenomics really examines the interaction between nutrition and genetics. And it focuses on how subtle genetic variations in people can influence their response to different nutrients, and vice versa, how those nutrients can influence gene expression and function. And so it's a way to think about how we eat interacts with our genes to create health or to influence susceptibility to diseases. And so from a therapeutic standpoint, we often use nutrigenomics in kind of 5 key ways. We can use it to help personalize nutrition based on someone's particular profile. We can kind of guide towards certain types of food. It can be helpful for thinking about disease prevention based on someone's particular milieu or makeup. We can use it for optimizing nutrient utilization. So some people may metabolize B vitamins less efficiently than other people, and so they may need some more of that in their diet than a typical person would. It can help us think about nutrition gene interactions and perhaps even augment things based on particular treatment protocols, like cancer treatment protocols. And then it helps with tailoring therapies. So not only dietary changes, but kind of supplements and lifestyle modifications that might support treatments and improve outcomes. And so this is a tool that we're starting to use more and more. And the way it's done is you basically can test it's kind of like cancer gene testing. But instead of looking at markers for cancer, you're looking at markers for metabolism and inflammation and oxidation. And these are things that you're born with. So you don't need to do this genetic testing more than once. You do it one time. It's typically like a saliva sample. And then you get a profile based on, the particular combination of genes that you as an individual have. And everyone's different. There are billions of possible combinations here. All right. Okay, then let's talk a little bit about activity. So activity can be complicated in cancer treatment. We know that exercise is good for our bodies, but it's harder to know what that looks like for cancer. But what we have been finding is that for most people with cancer, exercise is safe and helpful before, during, and after cancer treatment. It can increase quality of life, it can increase energy, may help manage side effects, can help manage body weight, can improve outcomes. And so the American Cancer Society and the American College of Sports Medicine both recommend trying to be as active as you can, returning to normal activities as soon as possible, doing regular physical activity, but also starting slowly and building up over time. And the goal is the same as it is for the general population. It's 150 minutes of moderate or 75 minutes of vigorous intensity activity each week. Exercise should happen a couple times a week, at least 10 minutes per session. And then it's helpful to include resistance training at least 2 days per week. So that would be like weights or bands or something. Kind of stretching, some type of stretching activity. So that could be yoga or just kind of a more generic type of stretching, usually 2 times a week. And then some types of balance activity as well. And so that's where yoga can also be very helpful. Yoga, Pilates, Qigong, Tai Chi are all helpful. All right. And then let's just talk a little bit about sleep. So sleep, super common concern in patients with cancer. There are a variety of ways to help manage this. And sometimes the major treatment is managing side effects of the cancer treatment itself. So it may be that a medication is causing difficulty with sleep, or it may be that pain is causing difficulty with sleep. And so, it can be kind of a multi-pronged approach. We talk a lot about good sleep hygiene and good sleep habits. Those are things like keeping your room quiet at night, keeping it dark, keeping it cool, having loose, soft clothing on, avoiding naps to the extent that you are able to. That's not an absolute requirement. Avoiding watching TV in the bedroom, actually, it can be a really big one. Relaxing before bedtime, and not using screens in general before bedtime. Going to sleep and waking up at the same time every day, and then trying to stay active during the day. Those can also be helpful. Sleep medicines can sometimes be helpful. There's a particular form of cognitive behavioral therapy that we often talk about. Sometimes medications can be helpful. Acupuncture can be really helpful. And we have a specific tool that we sometimes use called vibroacoustic sleep training, which is kind of a structured program that is kind of a combination of meditation and actually sound retraining therapy, which is pretty interesting. And then finally, this is the last category. And then after this, I'd love to open it up for questions and comments. Integrative medicine is collaborative. And so it encourages collaboration among healthcare providers from different disciplines. But it also encourages collaboration from other people in your lives. And I think this effective communication and collaboration is really important. And I think specifically, it's common and understandable for people with cancer to have, to feel a lot of fear or anger, sadness, loneliness, uncertainty. And creating connections can be helpful in managing some of those challenges. Connecting with family and friends can be helpful, but sometimes connecting with other people who have experienced cancer in some way can be helpful as well. And so support groups can be wonderful. The Welcome Center, I know, coordinates a number of support groups. They can be in person or virtual. Some organizations do something called a buddy program, which matches you to someone who has had or has a similar type of cancer or the same cancer. Connecting with community can be helpful. It can remind you that life is more about your cancer. And that community might be friends, it might be an organization you're part of, or a book club, or a faith-based organization. And then I think counseling and therapy can also be helpful. That can be done through and in part, partly by your primary oncology team, but it may be helpful to have, to have a dedicated therapist as well. And so so this is, I think, my last slide. And this is a brief slide on a new program that we're developing at the Marcus Institute called the Integrative Cancer Recovery Program. And the program is really designed to combine a lot of the different therapies that we talked about today. with the potential to use kind of other therapies, some that we didn't talk about today. So we can do a lot of integrative testing, including some of the things that we talked about today. There can be some cognitive and psychometric testing as well, especially for people who struggle with brain fog or that's a really common thing in cancer treatment. There are some screening tools we have for people who are kind of out a ways from their treatment. We think a lot about cardiovascular health because that's, I think, an under targeted area of health and is an area of common concern in cancer treatment. We look a lot at body composition. And so muscle mass in particular is something that can become problematic in cancer treatment. And something called sarcopenia, and it can negatively affect outcomes. And so if we find that, then we can kind of adjust things accordingly. We have a couple of other tools. Hyperbaric oxygen sometimes is useful. Vibroacoustic therapy, sleep training we talked about. Sometimes we do targeted nutritional support, dietary therapy. Sometimes we give intravenous nutrition, mostly in the form of micronutrients like vitamins and minerals, because many patients with cancer end up having some amount of gut dysfunction. And so they may not absorb things well by mouth. Not always, but sometimes. We talk about mind-body therapies. We can provide guidance regarding other therapies like acupuncture. We don't offer it yet, unfortunately. And we have a smoking cessation program. So that's it. I'm going to pause here. I'll stop my share.